So as sport and exercise physicians, a lot of prescription that we do is exercise prescription, targeted exercise prescription. We know that as exercise physiologists, that's what you're all about, getting people functional and strong. You do various programs run at MTP, for example, the new program targeted at patients with osteoarthritis. Lots of evidence behind all of that. Tell me what a patient would expect.
So when a patient comes in to see us at MTP for the knee program, it's a really comprehensive assessment process first, and that's really because exercise means different things to different people, right? So somebody who's had a long gym history is going to gravitate towards gym work. If they're told they need to get stronger around their knee, they'll go and do the things they've always done. If they're a runner in the past, they'll try to do aerobic activities and things that they know they were able to do before. And sometimes just doing the thing that you've always done isn't the solution. It sort of might have helped you on the way to where you are, so doing more of it can just be, it'll be like poking a bruise. It just continues to put pressure on the same areas and keep irritating and bubbling away.
Sure.
So what we try to focus on is really getting to the detail of what is the limitation in the person's function. Is it related to their pelvic stability or their hips? Is it related to the strength discrepancy or their range of motion? But what are their most limiting factors? And drilling on those most limiting factors in almost a systematic fashion. And we use range, use strength, look at everything from one leg to the other, so they're not doing just two-legged work and they can mask it. And then look at bigger movements, how they step, how they sit, how they stand, how they stabilise when you narrow your stance off so that you don't have the normal base of support.
Yep.
And down to single leg. For people that are more capable, more functional, or they're still running around and playing, doing activities and playing recreational sport, then we can take them up into more dynamic stuff and check how they manage their dynamic loading around the knees. And then on the back of that assessment, then we can put together a bit of a roadmap for those people on addressing the most limiting factors. You know?
Yeah.
I think the thing that people will typically not do is the foundational work. It's knowing what things to drill in and target on,
Yes.
and then like what are the factors that are putting more stress onto their knees. Nearly always people get focused on strength or range of motion, but it's very rare that people focus on the how they do things.
Yeah.
Are they initiating movement that's putting a bit more stress to the front of the knee with every single step they take, or are they initiating the movement in a way that reduces the stress on the knee? And so in the exercise intervention, the value of, I guess, the exercise physiology expertise is knowing where to look for those problems.
Yeah.
You know? There's so many different exercise professionals, personal trainers and group exercise instructors, physios do exercise prescription, and Google is a wonderful resource for people to do exercise anything from, really. Or doctoring, yeah, that's right.
Yeah.
So, I mean, there's so much information at your fingertips, but then everybody has their own sort of unique set of circumstances, and knowing what's best for you is really what we try to do best.
Yeah,
on the back of that, then what the person's capable of doing will dictate what the exercises are, you know. Something that even with our staff, you know, when we bring a new person into the team, often I get a lot of questions about, well, what exercises are best for this? What exercises are best for that? Or my friend, or a patient might say, my friend does these exercises. Should I do those exercises?
Not always.
You know?
Yeah.
Yeah, and there is no, in my opinion anyway, and the approach we take with the knee program, is there is no right exercise necessarily, but there's more or less appropriate exercises for the person, and then there's exercises that are going to get you to where you need to go faster, and you can kind of layer on top of quicker without the same irritation. So I guess the real delineating factor is narrowing down the focus on what the most limiting components are, and then putting together that roadmap for how to fix it.
Great.
Yeah.
Sounds good.